Hi, everyone. My name is Kia Beth Santos, and I would like to thank you for joining us today for another installment of ToxTime. If this is your first time joining us, we welcome you. Today's presentation will be shorter than our previous webinars, since we are reviewing a scientific poster and look forward to our live Q&A shortly. Our topic today is on the prevalence of fentanyl and co-exposure in newborns. And speaking today, we have Mary Jones. Mary is the manager of the Mass Spectrometry Lab here at USDTL. She will provide a brief overview presentation discussing the reported results for umbilical cord tissue specimens received in 2020 at a national reference lab. A little bit about Mary. Mary is a certified toxicological chemist by the National Registry of Certified Chemists, and she has worked in the field of forensic toxicology for over 30 years. She has participated in the development of over 100 methods for the detection of drugs in various matrices, including research at USDTL on grants through the National Institute of Health. So with that, I will pass it off to Mary.
Give me a second while I share my screen. All right, here we go. So first of all, thank you, Kia Beth, for that wonderful introduction. And I'd like to welcome the audience that's attending today. So let's get started. So the title of this poster, as Kia Beth mentioned, was the frequency of newborn fentanyl exposure and co-exposure to other drugs of abuse. And I'd also like to thank the co-authors of this poster, Joseph Jones and Shanti Hariharan. So why is this topic important? Fentanyl exposure in utero can lead to neonatal abstinence syndrome, which is a constellation of symptoms that occurs after opiate withdrawal and other substances too, including fentanyl. In this poster, we report results of umbilical cord tests received at our laboratory. Umbilical cord is becoming a popular specimen type for newborn toxicology. With umbilical cord, we get a universal collection, meaning that every baby has an umbilical cord available for testing, unlike meconium, which is sometimes lost in utero due to fetal stress. Umbilical cord is sensitive for drugs of abuse. And umbilical cord is collected immediately at birth, which means the turnaround time in comparison with meconium is much better because the turnaround time from birth to lab report is much quicker. So in the news for the past decade, we've heard about fentanyl seizures by the DEA and other organizations. And in the last 5 years, we've heard a lot of news about the drug dealers cutting heroin, cocaine, and methamphetamine with fentanyl. And they do that because fentanyl is cheap to produce. It can be produced in a laboratory, it's synthetic. It doesn't need to be planted, harvested, and processed like things like heroin and cocaine. So they increase their drug supply by adding in fentanyl. So the specific aims of this retrospective study were to report the prevalence of fentanyl exposure and co-exposure patterns to other drugs of abuse. Now keep in mind, our umbilical cords come from a high-risk population. These cords are collected when there are red flags at delivery or the baby is in some kind of distress in the NICU. So we performed a secondary analysis of historical data received from January 2020 to December 31st, 2020. And here were our observations. In that time, we received 23,104 umbilical cords that were tested for drugs of abuse, including fentanyl. 9,667 of those were positive for at least one drug. 429 were positive for fentanyls, giving us a 2% positivity rate. It's important to note here that fentanyl when administered medicinally or taken illicitly, is metabolized in the body to norfentanyl. The presence of either would indicate fentanyl exposure. So in our study, the median concentration of fentanyl was 4,029 picograms per gram. Norfentanyl was 10,756 picograms per gram. Of the 429 specimens testing positive for fentanyl, only 33 samples were positive for only fentanyl and norfentanyl, which means 92% of those babies that were exposed to fentanyl were exposed to another drug of abuse. So let's talk about our cutoff. A cutoff is the decision point at which we say a sample is positive or negative. If it's below the cutoff, it's negative. If it's above the cutoff, it's positive. So during method development, keeping in mind that a certain percentage of moms are given fentanyl during labor and delivery, we wanted to make sure that that cutoff wasn't set too low, that we would be picking up those moms that were given it during labor and delivery as part of an epidural. So we partnered with the Charleston Area Medical Center and we did a study. We had access to the chart results for 67 of moms, 37 of which were given fentanyl during labor and delivery. None of those umbilical cord samples from those cases were positive above 200 picograms per gram. Interestingly enough, we did have one positive, which was well above 200 picograms per gram for both fentanyl and norfentanyl. And there was no chart information indicating that fentanyl had been given during labor and delivery. Another note about our testing is it's twofold. When a sample comes in, it is screened using immunoassay. If the result is negative, the sample is reported negative at that time. If it's positive, it's actually a presumptive positive, and the sample goes for further testing. That confirmation test is done with a second portion of the sample, and it's also done by LC-MS, or liquid chromatography mass spectrometry. In development, the cutoff that we have determined is challenged. Our accrediting agencies have criteria that they've established for method development, and it's really a rigorous process. Not only do we challenge the cutoff, but we also have to challenge 40% below the cutoff in order to have a cutoff at 200 picograms per gram. We had to challenge that at 80 picograms per gram. And that will allow for us to day in, day out, accurately detect fentanyl at 200 picograms per gram. Initially, when we started this test, offering the test, our cutoff was 500 picograms per gram. And we heard from the field, from our clients, that we were missing some. So we went back and we looked at our data and determined that we could lower the cutoff to 200 picograms per gram. So now we'll move to the middle of the poster, and you can see a list of drugs. And I'm going to start at the bottom because the bottom of the poster are those drugs that we saw co-exposure with fentanyl most often. And next to the name of the drug is actually the cutoff for that drug, because all cutoffs are different for different drugs. So we'll start with morphine, which has a cutoff of 0.5 nanograms per gram. And we saw that 56.6% of the time. Next up, methamphetamine at 5 nanograms per gram was seen 40% of the time. So 40% of the time, we saw methamphetamine when we had a fentanyl positive. Next, amphetamine, which can be a metabolite of methamphetamine or can be given medicinally, has a cutoff of 5 nanograms per gram, and we saw that 33% of the time. The next significant drug was THC, which is a metabolite of marijuana, which we saw 26% of the time. For cocaine, we test for benzoylecgonine, which is a metabolite, cutoff 0.5 nanograms per gram, and we saw that about 25% of the time. And then lastly, I think of importance, is 6-monoacetylmorphine. It is a metabolite of heroin, and we saw that 15% of the time. So in conclusion, non-medical use of fentanyl is an alarming trend in this country. It includes the maternal demographic reported here. Prenatal exposure to fentanyl, 92% of the time, includes exposure to other commonly abused drugs. In most of these cases, the moms don't realize the danger they are putting themselves and their newborns in because they don't know they are taking fentanyl. So I'd like to thank you for listening. And Kia Beth, we can take some questions now.
Mary, thank you so much for sharing your findings today.
Subscribe to our channel to see more videos like this.